Hi, I'm Ralph Preston, and every Tuesday at 11 a.m. Eastern, we have these Stroke Buddies Recovery and Science Zoom meetings, which we also stream on YouTube Live. I believe in science and talking to therapists, and because I believe a focused approach helps you the most in your recovery. And today we've got Julie Wall. Julie is a occupational therapist, and she is also interested in caregiving and does some work in caregiving. She's got an online program and a Facebook group called uh, Caregiving Through a Therapeutic Lens. And today we're going to let her talk a little bit about that program, and then we're going to discuss caregiving. So, Julie, why don't you tell us a little bit about your background and how you got into the caregiving aspect?
Yes, thanks for having me, Ralph. Happy to be here. So, I've been an occupational therapist for about 11 years now, and I've specialized in neurological rehabilitation for most of that time. And I've worked in a variety of settings, outpatient rehab for quite a number of years. I worked in the hospital setting, inpatient rehab, and now most recently within the home and community during neurological rehabilitation. And so I love this population. It's a passion population of mine. And I just started noticing over the years of working with this population and their caregivers and their loved ones that there was this disconnect between the work that was being done within the clinic and then the work that was being done at home. And realizing that, the amount of formal training and education and time spent with the caregiver who's with them, 24/7 when they leave the clinic, it's not enough. They're not getting enough. And even in the hospital-based system, we're working with people for at least 3 hours a day in inpatient rehab. They're getting ready to go home, and we have maybe one day where we're doing caregiver training, and then we kind of send them off to home with their loved one, and we go, okay, best of luck, And I just felt like, again, it wasn't enough to really give the caregiver confidence and mastering any form of skills to help their loved ones. So they're kind of struggling and figuring it out as they go. And in the work that I've done and talking with a lot of caregivers, they over time, a lot of them do figure it out and they have gained a wealth of their own knowledge. But I just thought, well, wouldn't that be so wonderful if there was a way for them to get more formalized training, education, support, to just help them to gain more confidence in this role. It's a role that we don't choose, right? It's usually a role as the caregiver that's given to us when something happens to a loved one. There's no manual for it. There's no step by step. Everyone is individual. We know every brain injury is individualized. Every care partnership is going to be, unique in its own way. And so I wanted to develop a program in the online space that was going to really cater to that personalization and uniqueness and provide the caregiver with training. And the crux of it really is to train the caregiver how to think like an occupational therapist. As an occupational therapist, we have very unique lenses in which we look at our patients. It's a very holistic lens. We are constantly looking at the person, the environment in which they're in, and then the occupations or daily activities, right? We think of occupation as, well, how do you occupy your time? How do you occupy your day? What are those day-to-day activities that you need to do, want to do, or have to do, and can no longer do because of a stroke or a brain injury? And we're constantly looking at these three domains. We're trying to find the just right fit between those three, because when it is a good fit between these three domains, that will allow for what we call occupational performance, or performing, engaging in their day-to-day activities. And I was just thinking, how great would it be to have caregivers who are with these loved ones for, 24/7, to have that knowledge, to have that perspective, because then they, within their own natural environment at home or within their community, they know how to modify, adapt, shape these different domains to help create that just right fit for their loved one, which will then help them to be more independent, which will then reduce that burden of care on the caregiver. And so that's really at the crux of the program. And then in addition to that training, I'm offering individualized education. So if there's something that the caregiver really wants to learn more about and eventually master, I'm providing that one-on-one education. It might even be through a customized video that I can send to them so they can watch it, rewatch it, learn, try, fail, try again, right? And so it's really about creating the time and the space for caregivers to learn, to try, to get feedback, to really gain mastery over certain things that are important to them.
Well, and I can tell you that it's needed from my own experience. I was in a rehab hospital for about 3 weeks and actually had couple two occupational therapists, or even three, because I had two that switched off between hand therapy, hand and arm therapy, and then I had one that came around and they did a pretty good job of trying to do things like teach me how to get dressed again. Actually, they had an old wrecked car out back that they
Mhm.
then also teach you to a couple of different ways to get in and out. Of course, you learn how to get in and out of a car when you can't walk up to the car. That's kind of always interesting. But so there were a couple things like that. But as far as the caregiver aspect, the only thing they had was they did like 15 minutes with my wife. And it was how to help somebody get on and off of the toilet. Well, I was doing deep knee bends. I couldn't stand up very well, and my balance was still an issue. So I held on to things, but I did, for whatever reason, I decided I wanted to be able to do all the way to the ground, deep knee bends. And so I was doing that pretty good. I didn't have any trouble. I didn't need the training. I didn't need any help getting on and off the toilet except for touching things and balance, and they didn't have any option. I mean, there wasn't, well, what else could we do with this 15 minutes? They didn't really have any option. Then they sent us home with no shower chair, no shower bench or anything. So I go to get in the shower and I go, how
Now what?
now what? Yeah, literally, now what?
Yeah.
So I called back and they said, "Oh, just go to the place that you got the wheelchair from and get a shower bench." But but there was no instruction on like which one and how to get on and off it safely or anything like that. So
Yeah.
this is
It's so minimal, and we're so crunched for time in that setting, and obviously the loved ones and the family, they have work that they're doing. They're trying to get the home set up, so it's difficult to coordinate a significant amount of time when you're in that inpatient rehab setting, but it's so vital. And then everyone is so overwhelmed with information at the beginning of it all, right? The acute phase, you're in the hospital, a brain injury has occurred, and everyone is in survival mode. And then even when people go to the inpatient rehab setting, it's still a lot of information that's being thrown at you, both as the survivor and the loved one caregiver. And so you're just trying to take it all in, and it's hard to digest it all, right? You're getting handouts and folders and everyone's talking at you. And it's very overwhelming. And so then you go home and you finally have a moment to pause and breathe and digest. And you just go, wait, what did they say? What? I don't remember what did they say? And so then you're left with, okay, yeah, that now what? And so I want to be the now what? I want to be the OT in your pocket that you can reach out to and call upon and say, okay, here's what we're dealing with. You know, what are your thoughts? And instead of me just giving answers, I'm going to basically train the caregiver to think like an OT and go, okay, well, here's how we can go about this. There's all these options. What's going to work best for you? Maybe we try something. We'll see if it works. There is a lot of trial and error in this field of because everyone is not going to react the same way or benefit from the same things. And so again, it's giving that space and that time to digest the information, to actually implement things and see what works. And I mean, it can be, I'm just thinking of cueing, right? So in therapy, we do a lot of what we call cueing. And that's to give somebody, either a little prompt or a little word to cue them on something or a little touch. And there's all these different ways to cue. And again, we as the therapists, we're trained on this. We're given years of training and then field work and then our own life experiences, years and years of training. And so we do it naturally. It's just something that we naturally know how to do and how we know how to grade it. Well, then we're trying to teach this of how to cue to a caregiver in, like you said, that 15-minute time slot. And there's just no way that they're going to be able to recall all those details and implement it themselves. And so, something like that is within the program. Okay, let's go through what are these different levels of cueing? When might you want to cue this way versus that way? What's going to really promote their independence, their problem solving, their thinking skills, giving them the time to do that instead of what usually happens is the caregiver says, "Oh, let me just do it for you." Right? They don't want their loved one to struggle and suffer, and I understand that feeling. We are caring, we want to help, but I see you kind of shit, right? We know with that neuroplasticity, you have to give the person the time and the space to problem solve it themselves, to try things, to fail and then try again. And the type of cueing that you're giving will impact that. And so if you don't even know what those different types of cueing are, you're just going to kind of go in to help. And so, it's just even things that are relatively simple like that, just giving folks the time, the proper education, and then time to implement and get feedback on it will really help them as the caregiver to master that skill. So then they start to just do it automatically. They know what kind of cueing would be best in a certain situation and when to truly step in and help physically because sometimes that is needed, ultimately, but that's not what we want to jump in with.
Now, my advice would be to for the caregiver would be to take cues from their loved one. Don't do anything unless they really sense it or that they're in trouble or something. But because this was an issue for me, mostly with my wife, but also with a couple other people. Everybody wants to help you, wants to jump in, and I finally had to say, I need to do this myself so I can learn how to do it again. And of course, that brings up the whole thing about, now you as a caregiver, you're thrust into a role that you didn't ask for. There's one of my favorite lines is from a movie, Aphasia. Um, Hope is a four-letter word. And it says, what happens to one happens to two. So you've got a caregiver that's thrust into this role that they didn't ask for, aren't prepared for. And, it's a rocky road sometimes. Like all of a sudden you've got somebody saying, don't help me. Hopefully you don't say it like that, but it can be taken that way. There's an interesting dynamic involved in getting along in this whole
Yeah.
process. And then there's burnout too, but maybe we'll get to that. Um, yeah, I can't imagine. I got to, walking on my own again within a month or so. And I can't imagine somebody who had a worse situation than I did, because basically I was making enough progress that we knew we didn't really have to adapt the house, because
Mhm.
I would need the things shortly after they got installed. But if your loved one's going to be in a wheelchair for a while, and there's a lot more to do, and they don't do that much. They don't do as much as they should for caregivers. And it's interesting. I just thought of something. I was going to say care partners, which is obviously I think a better term.
Mhm.
And it made me think of the fact that I'm not here to say bad things about them, because I got good care there. But the rehab hospital I was in was called Care Partners, but they didn't have any programs whatsoever for the care partners, only for the impacted population. And one thing I would say to caregivers out there, especially if it's early on or maybe at any time, would be to, if you have the time and you can, to get involved and go to as many of the sessions. Like, people were allowed, my wife would have been allowed to come to therapy sessions and talk with me with a therapist and such. But she was teaching school and could only visit late in the afternoon when it was pretty much all over. So if your schedule allows, I think any involvement you have as a caregiver is going to help you with the knowledge you can pick up. And you're absolutely right. You leave the rehab hospital, you get in the car, you close the door, you drive off, and you go, "Oh my God, now what?" Because you also, when you're in a rehab hospital, you have access to all the therapists and doctors and such. So you've got a good supply of information, and leave the rehab hospital and you don't have your team around you all the time anymore. And you got to figure it out for yourself. Seems crazy to me. Both from the physical therapy point of view and certainly the caregiving point of view.
Yeah. But again, they're given so much information at the beginning stages of it all when there's this sense of overload and overwhelming, and they're still in that crisis mode. So, yeah, they leave the hospital and they're doing the best that they can. Absolutely. They're with what they're given, which is not much. But I'm trying to provide that external support with that of, okay, now when you have a moment, all those other questions are going to start to arise, the questions that you didn't think to ask in that acute phase because of the overload. And there's only so much in our brains that we can have capacity for in those moments. And so there's going to be a lot more questions that arise afterwards, concerns. Maybe we don't even know what questions to ask until we start kind of diving into what's going on at home. And so that's really where I think the magic can happen, is when we really take the time together one on one to dive into what is happening at home. What are those barriers to progressing? What is a barrier to you as the caregiver to care for yourself? Because we know that caregivers are not caring for themselves as they need to be. And again, we kind of think, well, who has the time? I'm doing A, B, C, D, and all the way to Z. So we're not caring for ourselves. And that can lead in itself to personalized illness, personalized injury if we're not careful. And so, really trying to reduce those risks of personal illness, personal injury, because we're not caring for ourselves in that role. And so, trying to provide some support on that level as well.
I just remembered one thing that they did offer, and I took advantage of it. It wasn't a requirement or anything, but they had a psychologist on staff at the rehab hospital, and they offered you a joint counseling session with your partner. And my wife and I did it, found it real beneficial. I can't say, I have no idea whether any other rehab hospitals out there offer that kind of thing. Um, but if they do, I would highly recommend that. I would also recommend that if you're having any, well, maybe to avoid having those, say if you're having any bumps in the road, to talk to a counselor, because that's very useful. But maybe you might be proactive and talk to a counselor to avoid bumps in the road,
Mhm.
because it
Yeah.
provides a safe place where you can kind of like say what you want without like what might happen at home if you do that all by yourself.
Yeah, I'm really glad that you bring that up. You know, one common theme that has been coming up as I've been talking with a lot of caregivers is this changes in motivation, right? Or fluctuations in motivation. You know, they as the care partner, I'm trying to help my loved one. They're not helping themselves. There's this lack of motivation happening over the course of recovery. And it's a huge topic. It's a huge concern. And I think it's multifaceted. It's very complex. What contributes to motivation? And I think absolutely the mental health is a big piece of that. So, you know, I think they say a quarter to a third of people after they've had a stroke will experience, you know, depressive symptoms or some form of apathy. And so, you know, I think one piece of that is exactly what you said. If you have opportunities or even seek out these resources, mental health, counseling kind of resources, if it's available to you, absolutely. If you, even if you think you don't need it, even if you think, no, I feel like I'm pretty strong mentally, I would absolutely encourage you as well to seek out those resources and take advantage of those resources. And then there's also other pieces to that puzzle as well that we as the care team and the care partner included, things that we can be doing to really try and help enhance that motivation. And so that's actually going to be the topic of my next webinar that I'm hoping to put out next month, is talking more about motivation. You know, what is contributing to motivation or the lack thereof, and what we can be doing as the care team, as the care partner, to try and enhance that. So that's going to be a topic coming up in the next webinar.
So that that would be very interesting, because motivation wasn't a big issue for me, but I run a bunch of Facebook stroke survivor support groups, and it comes up all the time. It seems like a lot of times the caregiver is more motivated than the stroke survivor, because we get a lot of questions like, he or she doesn't want to do anything. I can't seem to motivate them. Is this normal? What do you do to get them, to realize they, need to do therapy and they need to participate in order to get better? So, um, like I said, it wasn't an issue for me. I'm a bit of a maniac. I went at it pretty hard. I realized right away that in terms of physical therapy, that couple of sessions a week wasn't going to do it. So I did it like full time every day, all day, every day for like 15 months.
Mm-hmm.
And I got it, you know, put it pretty much behind me by being that intense about it. Most people don't do that. In fact, apathy is a big problem. Yeah, it's at least a third. They say it's a third of people experience depression, and I don't know. I don't know. You can't argue with statistics. You got to assume if you see that number over and over again that they've done research on this and that number is true. It sure seems like from running all the stroke groups, it sure seems like it's a greater number than that.
Mm-hmm.
But I, anyway, and I experienced depression, not severe depression. Um, I went through, days as a stroke survivor. You have moments at least, even if you don't consider yourself depressed, and or if you're not really deeply depressed, you have moments, and you have to learn how to bounce back from them. As a caregiver, you kind of have to watch what your partner's doing, and you know, and read the signs and interact appropriately. Know that well, it's just a bump in the road, they'll get over it, or whether or not they actually need some help. And I'm sure I'm getting ready to state the obvious here. Obviously, communication between the two care partners, the survivor and the care partner, is critical, as it is in any and all relationships. It becomes even more critical in this, because neither party knows what they're doing, in a sense. You're building
Yeah,
the
they're trying to navigate it together when neither one has a clear path
right.
forward. They're both trying to figure it out together, and it's a struggle. Absolutely.
You're both building airplanes while you're already flying them.
Yep.
So it's tough. You have any I don't want to, do you have any tips on keeping people motivated?
Well, I mean, I can certainly share, and I will share more extensively in the webinar, kind of what my experience has been from a therapy side of things, because that's something that we encounter all the time when we're doing therapy with, our patients. A decreased, desire to engage, that apathy, the lack of motivation. And I think one of the biggest things for me, at least as, again, somebody who's caring and treating a patient, is keeping in mind that it's not laziness. It is not their conscious decision to, well, I'm not going to do this today. It's part of the brain injury. And I think having that separation helps, because instead of us just getting frustrated with, well, why aren't you doing this? Why aren't you getting up out of bed? Keeping in mind that it's the brain injury that is contributing significantly to this behavior. And so some things that have been helpful for us within a therapy setting has been really taking the time to ask them, well, what is their goal? And so instead of me as the therapist coming in and saying, okay, we're going to get up and we're going to walk and we're going to get you strong to do ABC, instead of me superimposing my ideas and my thoughts into it, treating the person like they're the expert, because they're the expert in their own lives. They have their own desires, they have their own goals, and maybe it's totally different from what I think needs to be the goal. And that's okay. And so taking the time to ask, well, what is your goal? And then when they express that, making sure that it's not too far off, right? So if they have, a lot of times I get those really lovely long-term goals. Well, I want to get back to driving. Well, I want to go back to work. Okay, lovely. What is that next step we can take towards that, right? What is that next step goal that we can take to get you on at least that road towards your goal? And then when we come up with that together, that kind of that next step goal or a short-term goal, then as the therapist, I can say, okay, well, here are the options, A, B, C, of what we can do to meet that next step goal, because I want to help you get there. So really, again, just really focusing it on what they are wanting, what they desire, what's going to drive them, because it might be totally different from my own goals and thoughts. And so tapping into that, and then having the knowledge, and again, this is where the training to think like an OT can come into play again, is breaking down what their goal is into individualized parts or tasks, right? We are doing a task analysis here. And how does that work? And what are those breakdown steps that we can be working on to make our way to that next step goal? And making a couple suggestions, instead of saying, well, we're going to do this, say, okay, well, we can do this or this. You choose, right? Giving them that control back a little bit can be really helpful, because they're living in a world where all of their control is taken away from them. And so giving them some bit of control back into their decision making to reach their goal can be helpful to enhance that motivation. And we can absolutely break that down a lot more. I won't spend the time doing it today, but that's been helpful within at least the therapeutic setting to help people to really be the drivers of their treatments.
Yeah, the things like how to take a shower and put your pants on before you figure out how to drive or go back to work. Um, I'm glad to hear you say that you deal with talking with your patients with goals, because not all therapists do. From the coaching stroke survivors side, I always encourage people say, I got OT starting next week. What do I do? Well, thing I would tell people would be to talk to your therapist about your goals. Um, Not necessarily as short as, well, it could be as short as taking a shower and putting on your pants, and not as far reaching as something that's not obtainable for quite a time, but have some kind of idea of some kind of progression that you want to make to get to like what I would call midterm goals.
Mm-hmm.
And be on the same page together,
Yeah.
and use that as a reference point, in terms of uh, what you're engaging in from week to week, and it's also a good way to monitor your progress. Make sure you're making progress and that you're staying on the same page. Um, so
Yeah.
yeah,
And visual representation of that progress is vital. I mean, I tell my patients and their caregivers all the time, I know you might not want to be on camera right now. I know you feel like it's not your best moment, but recording yourself doing something and continually, whether it's once a week, every couple weeks, once a month, even continue to record, because the day to day, you might not see it, you might not feel it in yourself, but then you record yourself doing the same activity once a month. And if you're working on it, if you're working hard, you will see a difference. You will visually see on the video those changes. And that can be really motivating as well. I mean, talk about motivation. People, they don't feel those day to day changes. So recording them visually is a wonderful way to be able to see what those changes are and that progression, because it is usually small and slow, but you will see it. And just seeing the changes a lot of times with my patients, that will help to motivate them to keep going to that next step goal, just to keep going, keep moving forward, keep progressing in that direction.
I always use it's a bad joke, funny analogy, yeah, but it's true. You can't watch your hair go gray because you wake up every morning and you see it, and you don't notice the changes. You don't see somebody for a while, and they definitely, they'll notice. Sometimes they'll even say something.
Yeah.
But um, yeah, so I always encourage people to either do stills or video, either way, because a lot of times people will go back and take a look at something in the past, about, and they'll remember like, oh wow, that's when I couldn't do a sit to stand yet, or that's when I couldn't do this yet. It'll cue them to remember that they actually have made progress, because we
Mhm.
tend to overlook it. And progress is, I think, the biggest motivator that there
Mhm.
is, along with success. I always try to encourage people, and I would encourage them to set small, achievable goals with their therapist when they come up with the overall goals and plan, because I feel success builds on success. So I
Mhm.
make a series of small, achievable goals, and I try to meet them, because when you meet them, you're motivated to make another one and meet that one and keep, ticking it off and get towards the more of the mid-range and longer term goals. You only get there by building up the pieces.
Absolutely. Absolutely. And then, so going back to as the care partner, right? So your loved one creates this next step goal with their therapist, and then they're home with you for most of the hours a day. Well, how wonderful would that be if they, knowing what that next step goal is, they can contribute to shaping, adapting, modifying what's needed to promote success, right? So to have that skill set and master it, to know, okay, this is the next step goal. Ooh, okay, I have ideas of how we can help to get you there. It's still you doing it, but if we can shape the environment, modify the activity slightly to then progress, you have success with that, and then we just keep going from there. Like you said, success builds upon success. I completely agree. And there's a lot of things that we can do as the care partner to promote that, to encourage that, to contribute towards it. So,
Well, in an ideal world, therapists would encourage,
mhm,
allow at least, because some places don't even allow the loved one to attend either whatever therapy sessions, physical, occupational, speech. But in some cases they do. And if you as a team have uh, can make that happen, then you're the person who's helping the survivor will have a lot more knowledge. If you can't make that happen, then maybe a good thing to do would be for um, every time you're talking about goals or doing a session to like do a debriefing. So
mhm.
what'd you do in therapy today? Did you meet last week's goal? What kind of new goals or homework did your therapist give you for this week? And how can I help make that happen for you? What do you want? Another thing would be a good thing for a caregiver would be, what do you want me to do and what do you don't want me to do? Um, I
Yeah.
think we get in trouble. Well, not trouble, that's the wrong word. I see a lot of caregivers that are, um, well, they seem to fall into a couple of categories. Not overzealous. They actually seem to have more motivation than the stroke survivor, and
Mhm.
you can't do it for them. I mean, that would be some advice to anybody out there who's a new caregiver. You can't do it for them. The best you can do is to try and help them do it, try and keep them motivated, try and, like you say, set up things during the week to make those goals more achievable. Um, so,
Yeah. Yeah, I remember, working in inpatient rehab and, just keep hearing the best way to help them, don't help them.
that's,
Just, and that's, it's a simplified version of it because there are things that are going to be needed. But yeah, I think the physical hands-on, let me do it for you, that's kind of the last resort. Don't start with that. Always start with, there's a lot of other things that you can do to support them to do it for themselves before stepping in physically to assist. And so you
no,
always want to start with kind of the other side of it. Yeah.
no, I agree, because from the stroke survivor perspective, I didn't want anybody to do things for me because I needed to do it myself. So, but being supportive, I was thinking more like if you went to sessions, you might be able to, if it was safe and appropriate as determined by your therapist, you might be able to learn how to walk your loved one with a gait belt, or how to spot them when they're doing
Mhm.
counter exercises or certain things. Um, there's certainly things you can do that don't interfere that are real beneficial, like what's a form of spotting them when we're in difficult situations, like going up steps in the beginning is kind of tricky. Rather than run up the steps and be at the top and go, come on, come on, come on. Maybe you should like be behind them and be encouraging, keep them, be in a place where you might actually be able to help them if they fell or we're getting ready to fall or ask for assistance. But yeah, but
Absolutely.
kind of being there for them, more like an encouraging spotter. And the more you can learn about therapy, so it's true for both survivors and caregivers. There's some caregivers that get involved in actually hands-on helping. I know several couples where the 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 care partner gets involved in helping with the things that they're qualified for in terms of the therapy or the homework. I'm a big believer in getting homework from your therapist, whether it's speech, occupational, or physical, because therapist is like a piano teacher. You're at the piano lesson when you're at therapy. You're trying to learn the things that you're going to do when you go home that week and practice. You don't get, if you only went to your piano lessons, you might
It's
get
not
better.
enough. Yeah, it's not enough.
Not enough.
Yeah.
We all know that. Our it's not just the US, but in the US, you get a certain amount and it's not enough. I mean, everybody graduates from therapy. That's a polite term for your insurance has run out or you're not improving or whatever. We won't try and diss insurance companies and therapists and such. Therapists kind of have like, well, this as a therapist, you kind of got your hands tied by the insurance companies and the healthcare system. They're what's controlling what's happening to us. The survivors, we're kind of, at the bottom of that heap. So um, you can't have too much therapy. You can't do too much therapy. I suppose you could do silly things like run yourself into the ground, but your body will stop. Your body or your brain will stop you.
Yeah, exactly. Yeah. It's hard to overdo it. It's possible, but it's especially with brain injury recovery, it's you want the balance, you need to rest and restore as well, but it's all about the repetitions. It's all about finding things that are important to you, salient to you, and repeat practice and find ways to help yourself to be successful in that. And then know how to grade, whether that's upgrading to the next level of difficulty or downgrading if something is too challenging. And understanding how to upgrade and downgrade is vital to success.
What I would say if you're having trouble doing something completely, you mentioned breaking things down. I thought in the beginning, they'd give me these sheets and I would like look at the sheet and if I couldn't do it, I'd still try and do it. Like I thought like doing a part of it or whatever. If I didn't do it exactly the way I was supposed to do it, like right out of the gate, then it was like cheating. And I learned a valuable lesson in my recovery. Um, and that was that because I wouldn't break anything down. But in a lot of cases, it's real valuable because of the whole motivation factor and getting where you want to get to. If you break things down, then you keep having successes. It's part of that setting small goals thing. Like, learning how to walk again. I mean, there are like 20 or 30 things that you have to think about at once. Don't lean, don't swing your leg, land on your heel, push off with your toe, don't let your knee lock, build up
Yeah.
your quads and hamstrings, work on balance. I mean, you got so much going on. There's just no way you can stand up, do your first sit to stand, and start like walking anywhere near where you want to be. So uh,
Yeah.
I found breaking things down and then putting them back together um,
Hmm.
was really valuable.
Yep, we call it part task practice.
Right.
Absolutely. You break it down, you practice, 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 and then you practice each of those parts separately to kind of feel competent in each of those parts, and then you can start kind of piecing it together. That's absolutely one strategy for regaining certain skills. Yeah.
Well, and once again, like I don't think you can do too much therapy. Most people either they're fatigue or schedule or both. um, gonna set some limits, but anything that you can, I looked at it as my job. I mean,
And that's the right perspective. Again, that level of intensity that's required to recover after brain injury, that is absolutely the right perspective. This is your full-time job. And so you mentioned earlier, that kind of comparison to a piano lesson where, yeah, there are some people who they go to their therapy session for 1 hour and then they go home and you see them the next week and you go, okay, what did you do since I last saw you? Nothing. And it's just not enough. And so really giving both care partners that understanding of what can be done at home, how can things be modified, shaped, graded to promote success within that, because it's not always going to be 100%. You're not going to achieve it right away. You got to work at it. But yeah, it's vital. There's so many hours in the day, and you got to take advantage of that time to practice, to engage, to do, to try, to fail, to try again in a safe space. That's the key.
well, the people you described that, just only go to the piano lesson, only go to the therapist. I do this thing. I've done this with a half a dozen therapists that they can tell the difference between the people who come in and go,
Yeah.
"I'm here, make me better," and the people that ask for homework. If you ask for homework and you do your homework, you're going to have a completely different relationship with your therapist than if you don't, because they want to
And
help.
we do know.
Yeah,
Yeah.
I know. I was getting ready to say, therapists are people want to help people. They're paying attention. So what I've always done is say, okay, what's my homework? And if it's something I know, okay. If it's not, I say, show me once, okay? And then because I learn visually. So
Hmm.
then I go like this, and I do it once or twice, and they go, yes, that's it. And then I go home. I do it like 10 or 20 times to like lock it in. So you don't have that, like you were talking about earlier, like, okay, what did they say?
Hmm.
Moment.
Yeah.
But you'll have a completely different relationship with your therapist. If you ask for homework once and you do it and you come back and demonstrate that you're doing something that you couldn't do the week before, or you're doing it better, you're maybe not where you want to be yet, therapist is going to notice that. You won't ever have to ask for homework again. You won't really have to do too much tweaking of the goals plan, because they'll realize that you want to get better and that
Yeah.
they treat you differently. I mean, it's human nature. Um, I'm not blaming therapists in any way. I'm actually blaming the people that don't bring their part to the whole table. If you want to get the most out of your therapist,
It
then
has to be that partnership. Yeah,
partnership.
absolutely. And so, yeah, I mean, motivation comes into play with that again. If somebody's struggling with that, that's absolutely something that needs to be addressed within therapy, because you can intellectually know that repetitious practice is going to be beneficial for you. But if that other piece is hindering that, if that's a big barrier, that lack of motivation or decreased motivation, I should say, then it has to be addressed because it's hard to move past that piece. So I think that's really important for both care partners to understand what's happening, what's contributing to that decreased motivation, and what are some things to at least trial within the home to see if that can improve, because that will make all the difference.
Absolutely.
Yeah.
I just, I was able to, I had a pretty good attitude from the get-go. I got through a lot of acceptance stuff even by the time I got home. Like I said, I had my moments and I did a year on antidepressants. Um, but the thing to do with depression is, or any ditch, try not to dig too deep a ditch. Try not to string too many days together. And I know that's easier said than done. And I'm not sitting here just somebody who didn't go through it, just, saying, well, just get over it. I mean, because that's the worst thing advice you can give anybody.
Yeah.
Caregivers and families, not necessarily caregivers, but extended families tend to, I think there's a lot of work that could be done on extended families. I don't know how to do it, but people don't understand stroke. They don't understand that it's not something that it's not like a cold. You don't get over it. You don't get better in a week. You don't get better in a month or a year sometimes. And this is something that somehow or another needs to be more education, I guess, with well, I guess if the caregiver was educated in this and had the right attitude, then they could start sharing that information with the extended family, you know.
Yeah.
Is I'm sure you've run into this. We run into groups all the time. People are saying, my family's driving me crazy. I don't understand. They keep saying, why aren't you better yet? So that's a real tough one. And I don't have all the answers to anything. I got a few answers to a few things, but that's a tough one.
Yeah, but coming to terms with that journey, accepting the journey for what it is, and it's going to be different for everybody, but at the same time, we know that the journey is going to be a longer road. And so understanding that early on, having that perspective, because I think, again, going back to the motivation piece, I think there's a lot of people who, after they have a stroke, yeah, they want to get back to their quote unquote normal lives, right? They want to get back to being 100% so fast. And when it doesn't happen, when they're not recovering at the rate, at the speed that they want to, it can be very discouraging for them. And then we get the perspective of, well, then what's the point? And so, helping people to have the best perspective possible. And it sounds like, you in your journey, you had a great perspective on it. You knew it was going to be a longer road and you were willing to put in the work for it. But a lot of people really struggle with that. And so helping both sides of the care partnership to truly understand what that journey is going to be like, and but also provide that hope, because that's also a missing piece, is people aren't given enough hope. They go to see a doctor and doctors are still telling them, okay, whatever you make, whatever gains you get in the first year, that's it. And I hate when people do that, and they still do that. And so, giving them that sense of hope still, that no, it is going to be a longer journey, but you can absolutely make progress well past that year mark. And so to
Oh,
keep going and to keep finding ways to, have those moments of success and be able to feel it, to see it, um, can really be helpful on the journey.
yeah, well, as you know, neuroplasticity lasts a lifetime. There's a famous treadmill study where they put people on treadmill as much as 20 years post-stroke, and even at 20 years, people saw improvement. A couple of things. People always want to know if they're going to get better. Well, I tell people no one can say whether you're going to get better. I can tell you if you work on getting better, you'll get better than you are. But that brings up the whole issue of like, I I tell people throw out the old rulers. The ruler that you measured your life with before a stroke is not appropriate post-stroke. So, um, when I was in the rehab hospital, everybody acted like, oh, they want to get out of there. I wanted to stay 3 more weeks and
Mhm.
get more therapy, but insurance wouldn't pay for it. It was a burden on my wife commuting. We lived an hour and a half, so she drove 3 hours every day to see me. And
Mhm.
so that was a burden, but mainly insurance wouldn't do it. But everybody else acted like, oh, if I can just get home, I'll be better. Like they were going to magically get wheeled across the front door transom and stand up and return out of the wheelchair and return to their normal life. It's not happening. Before I left the rehab hospital, I said, I'm I I'm not going back to my old life. It's gone. It's dead. I got to make a new life. And right before I walked out, I said, I just blurted it out. I was waiting for my therapist to walk out of the hospital. I kind of walked out of the hospital. I did walk out of the hospital. Wasn't pretty, possible arm and a half rolled foot. But I managed to do it. Anyway, I was waiting for her to walk out and I just blurted out, I'm going to be the best new me I can be. And that's the way you really need to look at it. The people that hold up their old life for a long, long time are the people that, well, we just said the neuroplasticity lasts a lifetime, but there's a reason that they say the year. It's usually older doctors and it's not younger clinicians that are saying that. And it's because there's something called spontaneous healing. Well, if you're holding up your old life and you're not motivated and you got a crappy attitude and you're not doing what you need to do to get better, you have more neuroplasticity closer to the insult, to the stroke. So, most important thing people can do is see how fast they can get over that whole attitude and acceptance thing and get on with their new life, get on with getting better, because you can heal faster in the beginning than you can later. I'm not going to deny that. I mean, I learned how to throw a tennis ball and videoed it at 11 years with my affected hand to prove it.
Yeah.
But and I also did like 10 hours a day for 15 months. I rested I did 50 minutes on the hour, and from 10 up till the next hour I'd lay down like King Tut on my bed and not take a nap. But just somebody told me that connections keep happening and that you need to rest. So I didn't really want to rest. I never took a nap. I'd taken one nap since my stroke, and it was about 3 years ago. And it was due to like not feeling well, nothing to do with the stroke, and I regretted it. It disorients me.
It can. It absolutely, like when you take a full, hour and a half to 2 hour nap, it can be very disorienting. I'm personally more prone to just taking those 15 to 20-minute seated rests where you sit in a comfortable position, you allow your eyes to close, so you're reducing the amount of stimulation that's coming in. So you don't want to be looking around. It's not scrolling on your phone. You're really allowing the eyes, the brain, the body to relax for a solid 15 to 20 minutes. That in itself can be very restorative of our overall energy. You don't necessarily have to lie down for that 2 hour nap, which can be very difficult to wake up from. And then there's that disorientation that comes along with that.
I don't know how I just lucked into or figured out things. You're the first person I've ever heard say that, but that's pretty much what I did. I would lay for about 10 minutes. I would lay down on my bed with my eyes closed,
Mhm.
my hands crossed over my lap, like King Tut, like a sarcophagus, and I would just I wouldn't say I was meditating. I was just trying to um shut off the monkey mind.
Yeah. Yeah,
Uh,
you don't have to have an active mind in that moment. The whole point is to minimize stimulation and just allow the body to restore a little bit. Absolutely.
I told my wife if I ever fell asleep, wake me up, but I never did.
Hmm.
I suppose it's a form of meditation, just quietness. I wish I'd known about breathing back then,
Oh,
because
that's a whole other topic in itself, the benefits and therapeutic, benefits of breathing. Absolutely.
we've
Wow.
we've touched on it here and there in
Hmm. I
meetings.
use it a lot within my practice because, I mean, again, for a variety of reasons and benefits, but to center yourself, to get ready for something, to reduce the monkey brain, to reduce the anxiety that's coming with it, to reduce the overall fight or flight response in our bodies that we tend to get and stay at a higher level than we should in this modern day society. We need to drop that, sympathetic nervous system down, tap more into the parasympathetic nervous system, that calm rest and digest system. So there's a multitude of benefits from that we can dive into later on an individual session.
Right. Like I said, I don't know how I managed to luck into or intuitively figure some of the stuff out. But that's what I did. I didn't know
Yeah,
anything about sympathetic and parasympathetic. I didn't know anything about lots of things about um monkey mind, importance of breathing, lots of things.
yeah,
If I'd known about breathing, I probably would have just done some simple box breath or something as a
yeah,
part of that rest. And I was doing it basically, as somebody said, connections keep happening. So I was just gonna I just decided I would shut off the input and let those connections happen. So
mhm,
that's what I did.
absolutely.
Um, yeah, and I guess we ought to let you get back to your daily routine. I will say to people watching this on YouTube, either live or in the future, that when I put up the video, I'll put up the all your contact information. So if
Mhm.
anybody and your Facebook group and all the stuff that I put up in announcing this meeting. And if you want, when you do that, well, I've encouraged you, and I saw you in other groups, and I encourage you to come post in some more active groups. And you've been doing a good job of that, so I don't think I have to tell you you're welcome to post about your upcoming webinar in the groups, because I think this is really a valuable topic and one that's not really getting addressed near as much as it should. And I know we didn't solve all the caregiver problems in the world here today in an hour, but hopefully we gave people a little bit of insight into some tips they can use to get along better and help their partner make progress without bumping heads.
Yeah, and I welcome anyone who is interested to, just ask questions or to learn more about the program to please contact me directly. I would love to talk with you more.
Right. And I'll put it in the description underneath the video when it's on YouTube. And you can look for it, Julie's post all in the major stroke buddies groups. And are you posting in Young Stroke as well? I think you are.
I believe so, yes.
And I kind of made that one of those stroke buddies groups. I've been running it for 8 years, and so I added stroke buddies to the name. So, uh,
And also, just one last little plug for anyone who is interested, I am also offering a free the Blast Dance Fitness class every week. And so I just wanted to quickly mention that for any, you know, caregiver, but also for any stroke survivor who is feeling up to it. It is a standing class, so make sure your balance is doing okay. But I welcome you all to it. Yes, and you can always do it modified seated in a chair. I will be in the future doing some chair style classes, but for now it's I would be standing doing the class, and it's very fun. It's a partner free ballroom dance fitness class. So if you're ever, fans of Dancing with the Stars and always kind of were curious about how to learn some of those fun dances, I welcome you to join me. And for the month of October, they will be on Saturdays at 10:30 a.m. Eastern time. So in the mornings, hopefully before, the rest of your weekend gets going. And the day and time is subject to change. So please contact me directly. And so that way you can stay up to date with the dates and any changes that might be coming.
I've seen you post those also, so you can find them in the links and the posts in the Facebook groups as well. Maybe I
Yeah.
should maybe I should take one of those. So when I was pointing at the chair, I was thinking, since it's standing, well, one thing I progressed in yoga from in the chair to behind the chair to no chair. So I was pointing at the chair. I didn't get up, but You can just put a chair or something in front of you, do it near the counter, someplace where you've got safety net. So,
Absolutely. Yeah, there is a chair version of it. So that I think in the future will absolutely be something I would love to bring to the community. But for now, it's, really trying to be more centered on giving caregivers an opportunity to self-care for at least once a week, come and, take the class. But again, I welcome anyone who feels like they're physically able to do that, and make sure you don't have any falls on my watch, though, okay? Make sure you feel like your balance is doing okay there. But it's an expressive art, and so it's a wonderful way to just express any emotions, feelings, thoughts that you're having. It's a way to express in a way that sometimes words, you can't do it through words. So I truly welcome it for anyone who would like to join me.
well, yep. I'm, maybe I should take that. I actually go dancing these days again after took a long time. Well, I just didn't think about it until I met some people that were playing and people were dancing, and somebody asked me if I dance. I said I used to, haven't tried since the stroke, and they said, "Come on."
Yeah.
I've been set a new record on Sunday, 2 days ago. I was dancing. Guys don't dance. I don't get it, but they don't. So I was dancing with 9 women
Nice.
in a
The
circle.
token male. We love that. Even when you can't dance, women just love men when they're just trying. It's so fun. I'm trying to get my little guys to take a dance class. I have a 5 and a 7-year old. I'm like, trust me, to do it early. Learn dance early. It's going to serve you well in life.
Well, I posted about it in one of my groups, and I said something like, "How come men won't dance?" And so one of the best comment I got was, "Smart men do."
Mm-hmm.
All
Exactly.
right. Well, thank you, Julie. Appreciate
Yes, thank you, Ralph. This has been
that.
fun.
Yeah. And maybe I'll see if I can't free up one Saturday to take that dance class.
Yeah, I would love to have you.
All right. Well, thanks again.
Yes. Have a great day.
Too.
Do all you can with what you have, in the time you have, in the place you are. Do all you can. Do all you can.